Hello, my name is Rita Dominguez and I work at Atrium Health. I'm a project manager for community health. I support the different initiatives that focus on addressing health disparity and health equities. I'm also a board member of the Latin Chamber of Commerce here in Charlotte since 2018, and I'm excited to be part of the Chamber's mid-year conference. Welcome, everyone. Today, I'm so excited also to have one of our key executives from Atrium Health, Dr. Kinneil Coltman, a Senior Vice President and Chief Community and External Affairs Officer at Atrium Health. Kinneil, would you like to introduce yourself briefly so we can learn a little bit more about your work and role at Atrium Health?
Yeah, thank you, Rita. Thanks for having me. I appreciate the invitation to have this conversation and appreciate the partnership with the Latin American Chamber of Commerce. So again, I'm Kinneil Coltman. I'm the Chief Community and External Affairs Officer for Atrium Health, and it's been a really wild ride for the last several months. I've spent my entire career in healthcare diversity. I was actually the Chief Diversity Officer for Atrium Health for the last 3 years, and then had the wonderful opportunity to be considered for the role that I now hold. Stepped into the role in December. Of course, you had the holidays, January hits, and then boom, a global pandemic unfolds before our eyes. So I'll tell you a little bit about my areas of responsibility at Atrium Health. So currently I'm responsible for our diversity and inclusion strategy, community health, community engagement, and corporate responsibility, our system career development center, and also involved in some work around the Charlotte Executive Leadership Council, which is a group of the CEOs from some of our largest employers in the region. So given those areas of responsibility, it was a fascinating experience to be onboarding to my new role at the same time that we were needing to mount up with a very bold, aggressive community health strategy, especially as it relates to testing. But also as it relates to the broader conversations that we are having as a community around racial justice and equity following the George Floyd killing. So it's been a very intense time, but I'm also really proud of how we have navigated and really provided a lot of community leadership during this very challenging time for not only our community, but for the nation and the world.
Yes, indeed. And other things that we're facing in particular with the Latino communities and all communities of color here in the United States, and in particular here in the Charlotte region and the surrounding areas regarding the disproportionately our communities of color, have they been affected with COVID-19, and how the system has dealt with the needs of the community here in the Mecklenburg County and surrounding areas. So please tell us a little bit about your role here at Atrium Health and what this period of COVID-19 has been like for you and as a healthcare assistant and one of our key executives at Atrium Health. What have you been facing as a healthcare system?
Yeah. As the first COVID cases began to make their way into our community in mid-March, it was lucky in that we were able to see some of the things that were happening around the country, and also taking note of some of the racial and ethnic disparities that we were seeing in COVID-19 in other parts of the country. And so when the first cases came to our community, one of the first things that we did was establish a multicultural communications task force. And that group's role was to provide culturally responsive communication, address myths and misconceptions that were forming and spreading in communities of color around COVID-19, such as immunity, home remedies, threats to immigration status, all those things that you might hear in the rumor mill in a particular community. We felt like it was important to get out in front of that early on. We also have, for many years, developed very robust analytics infrastructure around guarding against healthcare disparities. So we set up a COVID-19 electronic dashboard that allows us to measure all kinds of metrics from a clinical care standpoint and look at those metrics along dimensions of diversity such as race, age, primary language, things like that. We also set up a geographic information systems map, or you may have heard the term GIS map. And what that map allowed us to do was to see community spread in our community and where the hotspots were. We were able to overlay that community spread with other variables that we know that we knew from very early on mattered as it relates to the spread of the virus. So we were looking at population density, where are the most densely populated neighborhoods in our community that may be more at risk? What's the median income in different communities, and how can we make sure that lower income communities have access to testing? We were looking at the percentage of African Americans in a particular community. We were looking at the percentage of Hispanics and Latinos in a particular community. And that mattered a lot because as we watched what was happening in other parts of the country, we knew that in particular, African American communities and Hispanic Latino communities were being disproportionately impacted, and that we had to guard against that in our strategy. Mm-hmm. So very early on, after we did all that, we had 6 test sites set up in geographically disparate parts of our community, but we realized that we needed to do something more to guard against those disparities. And so we developed a radically new model of testing, and we found that health systems all over the country are very interested in learning more about this testing model. We call it our roving testing units, but these are essentially roving RVs that we go and set up at a particular site for a day, mm-hmm. and we'll do as much testing as needed to be done in that particular day. But these models are unique and different in that not only do we provide screening and testing for COVID-19, but we're actually screening for social determinants of health that relate to COVID-19. For example,
mm-hmm. So talk to a little bit about the challenges that when you implemented this new model out in the community, what were the challenges and what have been so far some success stories, maybe, if you can share something like that?
Yeah, absolutely. So as we looked at what some of the challenges were, it was just the logistics of getting this massive operation to the right places in the community where folks in the surrounding area needed access to testing. How we've navigated that testing challenge is to partner with phenomenal organizations like the Latin American Chamber of Commerce to bring testing to their sites, to their parking lots. So we've partnered with the Latin American Chamber of Commerce. We've partnered with many churches in the areas, different YMCA sites, and many other community-based organizations to actually hold testing at their facilities. But more importantly is that we've leveraged those partnerships to help us with grassroots communications, because you can set up all the testing sites in the world, mm-hmm. but if people don't know about it, then you've not really solved for the right problems. We also knew that we had to think differently about just the operational model, meaning that they needed to be open and after hours to provide access to essential workers who may be working, traditional work hours during the day. We did time studies to make sure that we were meeting those needs, and we would see a surge in volume at lunchtime and a surge in volume after hours. So because of those interventions, we've been able to actually close disparities in testing for all communities of color in the Charlotte-Mecklenburg region, and we're very proud of those accomplishments. We still know that we have a long way to go because, COVID-19 is going to be in our community, it would appear, for a good long time to come. And so we know that we're in it for the long haul.
Mm-hmm. Yes, and I know as part of Atrium's health mission to improve the health and elevate hope and advance healing for all, I know Atrium Health as an employee of Atrium Health and proud employee of Atrium Health. I know the commitment that we have to further educate and inform our community and how to stay safe and healthy. Can you talk a little bit about the new initiative, Para Tu Salud, for your health? Can you elaborate a little bit about that, please?
Yeah, absolutely. So because we're so focused on monitoring the data, We have had good support and traffic and testing from Hispanic and Latino communities in our area, but we did start to notice that the percent positive rate among Hispanics was increasing, really picking up significantly in the month of June. And this was something that was happening across the state of North Carolina, but was certainly true in the Charlotte-Mecklenburg region in particular. And so the first thing that we did was go to our trusted community partners who we look to for guidance and wisdom around what's happening on the ground, what are they hearing in the communities that we want to make sure that we're reaching through these strategies. Of course, Latin American Chamber of Commerce was a core partner in those very early conversations, but we convened a roundtable and we assembled many of the top leaders in the Hispanic community locally to guide us on what else we can do to make sure that the right messaging around staying safe and preventing spread of COVID was reaching our neighbors in the Hispanic community. And we heard a lot of feedback from that roundtable just around how messages that may otherwise resonate really well in other communities may not land in the same way in the Hispanic community. That in order to be truly culturally responsive, that we needed to develop educational materials and videos in Spanish first, and then translate them back into English, but to also be very mindful of how messages around social distancing may not be as culturally concordant for the Hispanic community, and that perhaps we need to tell stories about how this may affect families and may affect, a particular community. So we're working very hard on those models to make sure that we're meeting the needs of our Hispanic community members and that the messages and education that we're generating is very responsive to that. And so we branded all of that work as Para tu Salud, which means, of course, in English, it means for your health. Yeah. And so that is the overarching banner under which a variety of activities and outreach are happening to the Hispanic community, from patient navigation to grassroots education to culturally competent COVID-19 educational materials and videos.
Well, thank you. As a leader in healthcare, tell me a little bit about a message with the limited time we have here, a message for the future. Can you share some words of wisdom, inspiration that you want to share with those watching us today during this conference and, throughout the community?
Yeah, thank you for that question. I mean, I think for us, what we've learned is these are unprecedented times and they call for unprecedented solutions. And that means that we have to start with the end in mind, meaning how do we deliver what the community needs, no matter what that is, and not be bound by our conventional boundaries about how work gets done. For us, there are certain types of activities that health systems historically get reimbursed for through our payers and through the government payers. And so we've had to kind of lean into spaces that are a little different for us, making sure folks have access to hotels so that they can quarantine. But we're also, as a big purchaser of goods and services in our community, we're very focused on supporting the local ecosystem of minority and woman-owned businesses with which we do business with every day or aspire to do business in the future. We know that it's not just individual community members, but small businesses that are the lifeblood of our economy that we need to support. And so we're trying to come up with any and all ideas and solutions about how to support our community members, our patients, and also those businesses that we want to see in a thriving economic ecosystem in the future. And we're being very unapologetic about finding new solutions to do business with small MBEs. The Latin American Chamber of Commerce has given us several recommendations about can this business provide labels for you? Can this business provide promotional items for you? So we are game for all of those solutions because we recognize that the status of our local economy and the status of our local small businesses in turn determines the status of the health of our community. So we care about all of those things and want to solve on all levels.
What a wonderful way to end this session. We want to thank you so much, Dr. Coltman, for your time, for sharing all this information, for your support and commitment to our community, to the Chamber of Commerce, and to the community in particular. I'm grateful to have you here. Thank you for your words of wisdom today. We appreciate you very much. Thank you.
Thank you, Rita. My pleasure.